It was a challenging time to get everybody together to have one goal, which was to look after our patients with CV-19.
The greatest thing is how quickly team members have come together.
The attitude from the very beginning was one of a can-do attitude. I think the team recognised that the work that they were doing was history in the making.
Just behind me is the COVID-19 ward in Hammersmith Fulham. There was a lot of discussion that took place around how we were going to manage COVID-19 patients. We knew that acute services would struggle, and we were in a position where we had to think quite quickly how we would create capacity within our system to ensure that our patients were looked after.
This is the first ward, to my knowledge, of its kind in terms of having a psychiatric ward for patients who are diagnosed as being positive for coronavirus. And by managing what we can on the ward in terms of physical health and looking after the physical health and mental health interface, I think we are doing hopefully a fair bit to reduce unnecessary admissions and referrals to our very stretched colleagues in A&E and AMU, for example.
We just felt that actually, we can do this, and we became the COVID adventures. That's what we call ourselves. And, it's positive. We have an amazing team from this different discipline, from RGNs to RMNs. We've got doctors, and everybody has just worked amazing together.
We have a broader range of expertise and skills. Some of the nurses are more experienced in physical health, while some others are very good at providing psychological support.
In my role as the medical lead of the ward, I have purposely made it very easy for any wards within the trust to refer to us. All we ask for is a positive coronavirus swab, send me the referral, and we are more than happy to accept the patient, and then we can make sure that we have a medical handover. I think that way has worked quite well because it's reduced anxiety from both the referring team and the patient, made sure that we've got as smooth a transit as possible during what is probably an anxious time for everybody.
As a team, it was really important for us to involve the patients. So for example, it isn't normal practice for a mental health nurse to be wearing PPEs on a routine basis. So to have that conversation with the patient, to help the patient to better understand why Crystal is wearing a mask, why is Crystal wearing a glove, and it was not just to protect employees, but first and foremost to protect our patients.
We go in every day to the patients to let them know what's going on in the news, what the sort of general numbers are, just to give them a flavour of what's going on outside the hospital. We've also called all of their families after we've seen them, just so they feel like that sense of connection is still there. Obviously, we're not able to have visiting at the moment, and it's quite difficult for patients not to be able to see their family. But we call and we try and make sure that they've got an update on what's going on. And we've reduced our restrictions on things like phone use and internet, just so the patients feel like they're part of the overall picture and not being isolated as much.
I've been supporting all of the patients. I'm giving extra care to them, being with them whenever they have questions regarding the disease or regarding the virus, and always reassuring them that everything will be all right and they've been taken care of, and also reassuring their relatives.
Once you have the commitment and the drive and the motivation to provide the best for your patients, you can achieve anything really.
I like having a laugh. I think it's very important. We have a big team, we're a new team, we don't know each other very well. Now we do. So I just make sure that everybody has a laugh. It's a tough time. Even the patients, we need to have a laugh with them as well. It just helps everybody, keeps the spirits up, and yeah, it's just nice.
I've been really fortunate with the team that I'm working with. There's been two matrons, Fran and Christopher, and the service manager, Crystal. If it wasn't for them and their leadership skills and their enthusiasm to get this right for our patients, you wouldn't have seen the morale that you saw here today. It's been a really exciting time actually. Within all this, it's been brilliant to see how we've all pulled together.
I'm really proud and really excited about what we've been able to achieve in such a short space of time, and that's something I'll carry for the rest of my career. No matter where I go, this is something I'm always going to carry with me, and I'm really going to be really proud of what we've done so far.